I am Anwar Sadat from HelpAge International. I will be facilitating this session, a short session on inclusion to all of you. So I will go through the session, and at the end, if there is any question, so please feel free to ask if there is any question in your mind when we go through this. Thanks to NHN as well. Thanks to Humayun Bhai for organizing this important session for you. So let us start. Inclusion is basically an important agenda which is coming up at different forums, including international commitments and also donor priorities as well. So this is the reason that we are talking about this agenda. If you see at Hyogo framework for action, you can see there is emphasis on inclusion of older people and persons with disabilities and other vulnerable groups, including socially excluded groups. Uh, and there is also emphasis on engagement of these groups in disaster preparedness and planning. This is because, for example, some of these groups also have certain capacities. For example, if you talk about older people, they have indigenous knowledge which can be used while planning for disaster preparedness and response. Similarly, if you have seen the humanitarian summit, which was last time held in 2016, and you can see the core commitments, and in the core commitments there is commitment 3 which talks about leave no one behind, and leave no one behind agenda. There is again the discussion on older people and persons with disabilities and other excluded groups mainly. And then of course uh, United Nations Convention for the Right of Persons with Disabilities. So this is also rectified by Pakistan. This also speaks about the inclusion of persons with disabilities in humanitarian preparedness and response. There is another commitment which is Madrid International Plan of Action. This was mainly Madrid International Plan of Action on Aging, which talks about the inclusion of older people in a society, and the goal of this is to reach society for all. And what all said is because there is a research which says that the whole globe, the whole world is going through a demographic shift. This is because this is thought that, for example, at this point of time, men and women both are working, and there is, I mean, uh, less children are coming up, just 2 or 3. And then at the other end, the health facilities are improving, which means the overall age of human beings, they are increasing. So there will be a time, it's expected in 2050, first time in this world, it will be happening that the older people will become more than the children of age 14. So because of that, there is a lot of discussion on how to include these groups in humanitarian preparedness and response activities, and how we can better benefit from this. And this is why we talk about it. Now, the whole presentation, if I go further, I can I can share with you some of the experiences as well. For example, when we talk through this, that what is inclusion, we take the view of different people, and out of those, someone was saying that bringing everyone in is inclusion. Just taking the example of today's, maybe this webinar, you can say that if we are saying that everyone is in, everyone is included, so this means inclusion. Or when you are conducting a training, when you are doing a community level activity, you are inviting everybody, so which means this is inclusion. At the other hand, some of them, some are thinking one step forward, that bringing everybody in and then giving them a position for meaningful participation is actually inclusion. Giving you an example, that you are inviting a person with disability who cannot sit on the ground, and you are putting something behind the original people, original crowd, to have for his sitting, and afterwards in the whole meeting you just focus on the other people, and that person is ignored. Some of the people think that then bringing everybody in and then giving a position for meaningful participation, and then also making decision when you are in, is actually it this is inclusion. Some of them still think one step forward, that the person who is in can easily make decision when there is a power equilibrium. Everybody is giving the same power of making decision. So when you will be talking to different people in your community, or even in your staff, you can get these kind of answers when you talk about inclusion. But inclusion and exclusion are very, I mean, critical things. They are very diverse, and this is a very big chapter. I mean, for example, when you are, I have seen many of the organization when they design TORs. For example, when we are doing community-based disaster risk management, and we are designing some TORs for community level groups, for example, disaster management committees. In the criteria, we usually write that people from age 18 to 40 are capable of becoming member of this committee. Such type of examples are actually the examples of systematic exclusion. For example, people beyond age 40 are systematically excluded when you design such kind of TORs. And then again, bringing in is not always inclusion, because if you see at the picture, you can see that many people, they are involved in the discussion, but two older people are just sitting outside. And do you think they are okay with the discussion? Of course not. This usually happens when sometime you think that your point of view is not very important, and you are still sitting in any kind of meeting or any kind of training, but you are actually not saying what is in your mind. So this is another important aspect of inclusion and exclusion. This is usually called voluntary exclusion, when you volunteer that this your point of view is not very important. So, keeping in view all this, if we like to define inclusion, this could be, for example, inclusion is a process. This is not a one-time activity. It is a process through which the people at risk, mostly women, older people, persons with disabilities, children, and other excluded groups, can meaningfully participate in project activities and contribute in the decision making process, and their voices are heard. So you can see that there are some important things in this. People at risk mean that not necessarily always women and persons with disabilities are vulnerable. Sometimes a community living at the river bank is equally vulnerable to flood as older people and persons with disabilities. But out of those, older people and persons with disabilities are more vulnerable because they have other vulnerabilities. There is another concept coming up, where you can see that different kind of vulnerabilities exist within a same individual. For example, an older woman, a woman with disability, and she is from minority. So two, three different kind of vulnerabilities are in the same individual, and this concept is now called intersectionality, and this is also coming up very strongly at different agendas. Why the people are excluded? Actually, we would like to talk about the barriers to inclusion. One the biggest reason which have seen is the physical barriers, the access issue, which actually hinder the participation of these groups. For example, older people and persons with disabilities. And the examples of these physical barriers may include examples from infrastructure. For example, you can see in the picture there are uh, mm, stairs which are having steps. So any person who is using wheelchair cannot use these stairs. And then when you are organizing a training in the community level, so access to your training venue is actually, it could be a physical barrier as well, and the other hand it could be a facilitator as well. If you are organizing the training close proximity to the person with disability or any person who is disabled, and to his house. Access to safe location in case of any emergency is another barrier, and access to shelter and wash facilities is maybe another example of such type of barriers. Another barrier which is attitudinal barrier, and to us this is the biggest barrier, because this starts from individual, and then individual makes organizations, and if we as an organization want to work on inclusion, so first of all we need to change our attitude, that why this is important to have inclusion of different vulnerable groups. Sometimes in the community there is stigma about older people and persons with disabilities. In our community there are different types of this kind of stigma. Sometimes even you can see that when you are going to ask about persons with disabilities, these are our cultural norms, that no one will say that we have a person with disability at our home. This actually is making them more invisible, and that is the reason that they are excluded. And then the other is our stigma towards those groups. For example, if you see a person with disability, you can see community calling them with different names. So this is a stigma. We always talk about their vulnerabilities, but we never talk about their capacities they are having. And similarly for women, you might have seen the cultural restrictions on their participation and other things like that. Institutional barriers, adds this is very interesting barrier, and I have seen this so very much during my career, that the organizations who have their own vision and missions, they are actually work around that, and sometimes they do include older people and persons with disabilities and other vulnerable groups, but they do not include them systematically. When we go further, we will further define this, that what are those. So they don't have kind of, I mean, inclusive policies available with them through which they can systematically include these groups. And communication barrier as well. For example, if we are willing, institution is willing to include older people and persons with disabilities, then you can first face the challenge that when you come across to a person with disability who have different kind of impairments, for example hearing, visual, physical, and the things like that, so how you can communicate with those older people and persons with disabilities. And then understanding cultural norms is maybe also another barrier. You can see the picture that there are a lot of things are written on it, so we are all excluded at the moment from this information because we cannot read this. And this is what we do in humanitarian response when we are displaying some flip charts, some information material on different locations. So we need to look into that how older people are person with disability, and those persons with disabilities who have some kind of visual impairments, who are illiterate, can actually access our information as well. Now, theory of inclusion. The key themes of for theory of inclusion are: Equity and equality. The things which I shared with you earlier, organizational VN and other things like that. So beyond that, when you work for older people and person with disabilities, for example, I have seen many organizations who have equality policies. For instance, they saying that we are working equally for everybody, and this is not the matter that we are not catering older people and person with disabilities. Just giving you an example. Um, if you are distributing food items and for you the equality is that those food items should reach to everybody is somehow not appropriate if you are not thinking about the food packages who are actually appropriate to everybody. For example, candy biscuit, if you distribute candy biscuit, maybe older people who don't have teeth cannot achieve those. So thinking about that what is appropriate for everybody is actually the first theme of inclusion, that you are thinking of equality and but also thinking about equity. So equality should be a greater outcome based on the equity. Then identification by collecting sex, age, and disability disaggregated data. To us, this is a great challenge as well, because we have census in 1998, and after that we don't have any kind of census. So if you want to include older people and person with disabilities, the biggest challenge is that we don't know that how many older people and person with disabilities are there. So for you and for us as an organization, what we can do, we can actually collect sex, age, and disability disaggregated data to identify that how many older people and person with disabilities are there, and then design our services on that. Acknowledging vulnerabilities as well as capacities, as I shared with you earlier as well, that we mostly talk about vulnerabilities, but there is a great requirement that we should talk about the capabilities as well, not only about the vulnerabilities. So this is actually the theme on which right-based approach is also designed. Including an involvement, we need to know the difference between including different vulnerable groups and involving different vulnerable groups. The participation should be a meaningful participation, not for tokenism only. Uh, the the example which I shared in voluntary exclusion versus inclusion are some of those where you can actually meaningfully include older people and persons with disabilities and other vulnerable groups of women, children, like that. Not only that, to take that there were 50% women in our meeting, there were 7% older people, there were 10% with disabilities, but need to know that out of those, for example, 50% women, what they did when they were in our training, or what when they were in our any other activity. So then value for money and inclusion. In terms of donor, this is a great debate that um, well, money should be valued, and whatever resources are available should be utilized to have a big outcome. But if you talk about these kind of groups, when I was talking about physically impaired person, when I was talking about visually impaired person, and when I was talking about hearing impaired person, and when you compare these individuals to other individuals of the community, you can see that per beneficiary cost will go up as compared to the other beneficiaries. So sometimes the local organizations think that, for example, this will require more resources, and they define value for money differently, that utilizing less resources is actually value for money. No, value for money is actually utilizing whatever available, utilizing that more effectively to achieve more impact and outcome. And inclusion is not always costly. For example, sharing with you an example from international standards for inclusion, there is 0.5 to 1% budget required to ensure accessibility to infrastructure. So 0.5 to 1% is not a big amount of the budget, which can be. And then the other theme is oversensitization and understanding exclusion. This is very important. Sometimes we talk about inclusion and we talk about inclusion so much technically that we think that this is a very technical agenda, and the organization, especially the local organization, that is very difficult for them to fulfill this agenda. And when we talk like this, at that time we might miss some easy solutions through which we can include older people and persons with disabilities and other groups. I will give you another example of following this slide, that how you can actually achieve this. Then advocacy, awareness raising, networking. Definitely, for example, networking. Today, whatever we are doing, this is a kind of networking. Today, whatever we are doing, this is kind of uh, awareness. Okay. Now, key ingredients to inclusion. Again, you can see the picture that there are older people, there are older women there are persons with disabilities, there are young people as well. So whenever you are working on inclusion and whenever you enter in a community, please make sure that these four things are always in your mind. Number one, recognizing diversity. Recognize that there are different groups which exist in the community. Recognize that there are older person as well. Recognize that there are persons with disabilities. Recognize that there are children, there are women, there are socially excluded groups. So first thing that we need to acknowledge is actually the recognition of this diversity. When we recognize this, we will actually then maybe can improve our processes. Then participation and decision making. When you recognize diversity, when you make a group, when you bring everyone in, then make sure that everyone is participating meaningfully and everyone is making decision on their behalf. There is a very famous slogan on this, that nothing for us without us. So make sure that nothing for us without us is implemented. Then tailored approach. Do not do this in different episodes. There should be a tailored approach linked to all project activities, and make sure that the giving you an example, that when you design a project, you establish a committee and then you are doing all activities around that committee. So what if there are 5 persons with disabilities in that committee? So make sure that those 5 persons with disabilities are actually participating in all your project activities. Not like this, that there are 5 persons with disabilities in your committee and they are actually not included in the training. You think that they cannot come to the venue. They are not included in the seminar. You think that there is more cost involved to bring them in a seminar. Not like this. So this should be tailored with the other activities as well. And finally, the removal of barriers. So there is a there is also a great discussion on that, an individual is disabled or the society is disabled. So maybe at any other point of time we can have more discussion on that as well. So but when you remove a barrier, you will actually increase the access, not only for persons with disabilities but some with for other groups as well, like we mentioned about for example women. When you remove the barrier of cultural restrictions, for example, if there is cultural restriction that men and women cannot sit together, you can have their separate committees, and you can have separate maybe females to communicate with women. So you have removed a kind of barrier, and that ultimately increase the access of women participation. Then how we can include actually, there is a model which is very famous model which is called disability creation process, and now I'm going to link it with this theory of inclusion. Disability creation process is a very famous process, and this is famous because of its flexibility. And if you can see at the left side, you can see that there are risk factors which are coming down, and then they are going to the personal factors, which are organic systems over integrity and deficiency, and our aptitudes over capacity and our incapacity. These are the personal factors. And then there are other factors which are called environmental factors, and these environmental factors, there are hurdles, there are barriers, there are obstacles, and there are facilitators as well. But when these personal factors and environmental factors, they interact with each other, they actually make our life habits, they actually make us able to wash, able to eat, able to move, and able to dress every day, for example. So these are called activities of daily living. And then these our activities of daily living actually decides that we are socially participating or we have any kind of situation of disability. But this model became famous because when you talk about facilitators, when you talk about obstacles, both are very local, and they are at the very local level. For example, the barriers for the inclusion of women are different in KP. Barriers for the inclusion of women are different in Sindh. Women's for inclusion of women are different in Punjab, and even in Punjab from one city to other city. So both disability creation process and our theory of inclusion, they both focus on the environmental factors and local factors, barriers and facilitators. Both disability creation process and theory of inclusion, they focuses on local facilitators. I mean, for example, when we talk about women participation, we sometimes say that women participation can be ensured by respecting cultural norms, and in those cultural norms we can have separate meetings, for example, and in separate meetings we can have local females available to communicate with females. Another important example could be, for example, in Sindh, a person from Punjab may not communicate with the people who are less literate or less educated because he don't know maybe Sindhi or Saraiki. So if a person from Punjab is moving to Sindh, he can have communication barrier with the people there. But if and communication and Sindhi language is actually a local barrier, and when you have analyzed that barrier, you can actually make a local decision and can decide a local facilitator. Now what you are doing, you are actually then hiring a person who knows Sindhi, and he is easily communicating with that person who are less literate or less educated. So this is when you link it with the value for money, you can see that you are effectively utilizing money. You are not spending much cost because you are also reducing the travel of Punjab person to Sindh and the things like that. So both DCBs and theory of inclusion, disability creation process and theory of inclusion, reflect local champions. So which means that if we are talking about inclusion overall, and if we are implementing disability creation process, you being the local at the community are actually a champion. You knows the barrier well, you knows the facilitators well, so you could be a champion of inclusion. When I will be giving any input on the tools, on the processes and things like that, that could be one of my experience maybe, but you being the champion can actually say that this is implementable or not, and if not, what other things can be done at the local level. So both theory of inclusion and disability creation process, they are talking about the environmental factors, the local factors, barriers, and facilitators. If you like to include different vulnerable groups in at the local level, just you need to do two key things. Number one, identify the barriers. Number two, suggest the facilitators at the local level. Now, moving towards the final, I mean, point of this today's discussion: how to include um, different vulnerable groups. You can see this is one example from Concern Worldwide, who is implementing one of the biggest program, Rapid Fund, and that rapid fund is going down to the local organizations. We were having another similar kind of program which was mainly on capacity building, and those capacity building, it was more focused on inclusive capacity building, how to include older people and persons with disabilities in humanitarian response. So in that, what we did, we actually targeted target rapid for capacity buildings and including older people and persons with disabilities and their designs. And this is an example from those projects who were implemented in Tharparkar by some local organizations. So you can see that what basic steps they have taken in that they included older people and persons with disabilities and their beneficiary selection criteria. So if you give them a scope there, you can then actually do what we discussed earlier. I mean, number one, you are then acknowledging the diversity and you are including everybody. You are including general community, then older people and persons with disabilities and women, for example. And then this will also give you an opportunity to monitor, to keep a check on inclusion of different groups. For example, in beneficiary selection criteria, if there is 5% for person with disabilities, so from here on you can actually make a check that they are in the process and they are included in other activities as well. So one was this kind of thing. The other thing that they did is collecting sex, age, and disability disaggregated data. I have given some of the examples that how this will help you out. This can give you a male-female proportion. This can give you disabilities and male and female, and then this will also give you type of disabilities, that what kind of disabilities: physical, visual, hearing, and mental. When we were doing this, we were again having a challenge that project staff were actually, number one, they were not able to easily identify persons with disabilities. As I shared earlier, that due to cultural norms, sometimes the households, they do not actually tell you that they are having any kind of person with disabilities at their home. Number two was the reason that they were actually not aware of that how to communicate with person with disabilities. So communication with person with disabilities has remained a big challenge. I mean, for example, if we ask this like this, um, mm, up Mazuro, so this is giving some kind of different impression to the person whom you are asking this question. Or if we ask, for example, aap andhe ho, so this is giving a different kind of impression. So how to communicate with person with disability? There are some of the guidelines. um, for example, there are some donor driven but they are very effective guidelines. One tool is known as Washington group questions, which are actually driven by um, DFID, and that is a very effective tool which is used for systematic data collection for person with disabilities. You can assess the type of disabilities, and then you can also assess the level of those disabilities. So that is an effective tool. We can discuss sometime on it as well. When I talk about how to include, and I talk much about increasing access. So increasing access is the key to include different groups. So this is mostly used for person with disabilities, and this is sometime mostly related to infrastructure as well. But as I shared with you earlier, that access to communication system, access to the training venue, and then information, education, communication, even your and my communication is also, I mean, in it. But if you are talking about infrastructure access, there is a very noun terminology, which is noun formula used, which is called RECO. R is for reachable, which talks about more about the external environment of a facility, of a household, of a shelter, of a wash facility you are designing. So it should be reachable from the outside. The path coming to that and the route coming to that should be accessible for person who are using wheelchair, persons who are visually impaired, and the things like that. E is entrance, so make sure that the entrance is accessible. You might have seen many of the offices, many of the guest houses. Okay, so from my side, this is it. For further information, if you need any kind of information, you can maybe send me email on my email address. There is my mobile number as well, and there is my Skype as well. I'm to have a link with the minimum